Good evening, and we start with stark new evidence of the intense strain on hospitals across the UK as the NHS struggles to deal with the pressure of the winter months. Medical staff at the University Hospital of North Tees in the northeast of England say they don't have the capacity to give proper care to all incoming patients, and the Trust says the pressures are immense. A BBC News team spent several days at this hospital witnessing the problems there at first hand, as our special correspondent Ed Thomas explains now in this extended report.
Inside the NHS. For the first time, we've been given full access to a hospital this winter.
I've worked for the Trust for 19 years, never known it to be as bad as it is now.
Over a weekend, we spoke to patients.
It was supposed to be the best country in the world. We're nowhere near the best country in the world, no.
Progressively getting worse, definitely.
And met staff facing unprecedented pressure.
At the minute, we've just got no rooms in the A&E department, so these patients are just waiting here for the next available bed.
How do you describe the NHS?
It just feels like a disaster zone, isn't it? It's just completely under strain, bursting at the seams.
And what's it like being on the corridor?
I think it's worse. It's worse.
The University Hospital of North Tees. It has some of the best A&E waiting times in England, but was so full at one point this month had to close its doors. It's Friday, and we're in the Rapid Assessment Unit.
We'll do this one.
It used to be the hospital's gym.
It's always hot. It's because the windows are right at the top. It's like stepping off a plane abroad. That's what it's like. The heat it just hits you. You're comfortable there?
Patients with less severe symptoms can be sent here instead of A&E.
Right, well, I'm going to do some mobs on him first then.
Dawn's worked here for nearly 20 years. This has been her busiest winter yet.
It's exhausting mentally and physically, trying to keep up with everything we need to do in the short space of time we have to do it in. It can be hard and tiring, but I do love my job. We'll get you there.
Some patients spent up to 6 hours here. Average waiting times are not included in the hospital's A&E figures. How many trolleys have you got in here?
12.
How many patients have you got in here?
18.
How many more patients have you got to come in?
9. Well, 9 to come in.
It's about 2 hours before you get your blood results.
They haven't got the time to look after the patients and do their own jobs and everything. It's terrible.
The nurses get really upset, don't they? They really do get upset.
I think the nurses deserve better in their jobs.
The nurses couldn't do any more.
I think we need a proper area for rapid assessment.
If the patients weren't here, where would they be?
They'd be sat in A&E.
On Saturday, A&E is filling up. The Rapid Assessment Unit in the gym is closed.
Lady out of 12 is going into 9.
And Leanne, the nurse in charge, must find space.
Just more patients coming through the door, more elderly patients, more poorly patients. Draw back 50.
What are your concerns?
There's not the capacity. We don't have the capacity to safely look after the amount of patients that are coming through the door.
By 4 o'clock, ambulances are backing up outside A&E. Inside,
How's that pain on?
paramedics wait with their patients.
They said we've got nothing, so we've got to come round here.
She's looking after me lovely. I'm doing well. I'm in pain, but I've got up.
You're doing fine.
Blanche is 83. And she's struggling to breathe.
They're marvellous, these two men. They've never left me.
I know.
I'm in agony.
She's in a lot of discomfort, a lot of pain, and being sat on the stretcher in the corridor is not where she needs to be. We've given her what we can in terms of pain relief.
What does she need right now?
She needs to be seen by a doctor.
That's it.
Oh.
Paramedics told us they waited with Blanche for an hour.
When you see that lady down there for an hour,
it's awful. We don't like it. Nobody likes patients to be in a corridor. But I physically have no room to put this lady in. I have been down and apologised, but there's no physical bed to transfer this lady into.
Across the NHS, emergency admissions are at record levels.
Ah, you are doing fantastic.
what do these got mean to you?
They're amazing. They're amazing. Yeah, tenfold, they're amazing. Yeah.
Many hospitals are also facing a major flu outbreak.
What's this place meant to you?
She wouldn't be here. She said the same herself that she thinks she would be dead if it hadn't been for these doctors.
Here, it means by Sunday, every bed on every medical ward is full.
We're just trying to move some patients from orthopaedics to create some capacity. Hi guys.
It's Denise's job to find beds,
Hello, Denise speaking, site coordinator.
to keep patients moving through the hospital.
We can always want more beds and more staff, but you can't go on forever just using more beds and more staff. We've got to look at the other reasons why patients come into hospital as well, and is there any other resources that we can use?
Patients that are in trolleys and corridors are a very rare occurrence within the Trust. My concern is that the year-on-year increase in the acuity of patients and the number of patients coming to A&E is not sustainable. We need to transform our care.
From Friday to Sunday, the hospital failed to meet its A&E 4-hour waiting target.
Want to go check the floor? Give us a shout if you need anything, all right?
It averaged 85%, well below the 95% target.
We are losing a lot of experienced staff because they are becoming burnt out. They are realising that they can't keep going like this.
Discharging, but then when you discharge, it's been non-stop. We've had that many people through today that I haven't been able to give them a drink.
How does that make you feel?
Frustrated and sad, I would say.
Can you go on doing this?
No. I don't think, not just me personally, I don't think any of us can.
Well, you've had a few more years than me, and
yeah,
I think I've got less to give than you have.
How long do you think you can stick it out for?
At this moment in time, I'd say I've probably got about 5 years left, tops. And so far my career's been 4 years long. I wouldn't say I'd do a long career in the NHS.
Step back, Peggy, before you sit down.
And with our ageing population, more patients with complex acute conditions, more nurses leaving than joining in England last year, many want to know how the NHS can continue to cope.
Come this time next year, the same will happen again, and again, and again, and again. And we'll see all these pictures in the news and the horrendous trolley waits, but it doesn't seem to change. Nothing changes. And I don't understand what else you need to make things better.
Lots of questions raised by the report. In a moment, we'll have a word with our health editor, Hugh Pym, who's at the Department of Health and Social Care. First in the studio with me, Ed Thomas, whose report there we've just seen. Ed, staff were remarkably candid about the immense challenges that they're facing. What were the impressions that you took away with you?
Yeah, that's right. It was incredibly difficult to get into that hospital to tell that story. But once we did, we were struck by how open, how frank, how honest nurses, consultants, healthcare assistants were. They wanted to come forward and tell their story. And the stories you've just heard there tonight, Hugh, they weren't a snapshot of a particular moment inside the hospital. They were representative of our time there, people who were tired and frustrated. And importantly, too, the pictures you've just been watching, the ambulances outside A&E, the patients queued up in the corridors, they match what clinicians have been telling us up and down the country this winter. But the one thing to take away from all of this was how incredibly hard the nurses and doctors were working inside that hospital to keep patients safe despite these winter pressures.
Ed, many thanks once again. Ed Thomas there for us. Let's go straight to Whitehall and the Department of Health, and Hugh is there for us. Hugh, the Prime Minister's already acknowledged, there are immense challenges in the NHS at the moment. Do you think that evidence of this kind, more evidence like this, is likely to bring a change of approach or policy?
Well, Hugh, the official line tonight is that the government did put more money into the NHS in England over 2 years in the budget and more for this winter's pressure. But nobody here at the department is denying that the sort of images we saw in Ed's piece may well be typical of hospitals right around the country. A&E units under real strain, difficulties finding beds and staff really feeling the pressure. I think it will add momentum to a debate going on around Whitehall about the long-term funding needs of the NHS. Jeremy Hunt, the Secretary of State's already called for a 10-year funding plan. His department's under pressure on another front tonight. That is over the calculation of these A&E stats for the key 4-hour waiting time benchmark. The BBC's become aware that a small number of trusts, but possibly more, have been adding in data from minor injuries centres, urgent care centres run by other providers into their own data, quite possibly to make their performance look better. And the UK Stats Watchdog, reacting to that, has called for a full set of explanations from NHS leaders. Labour is putting pressure on the government to come up with answers on it as well. And embarrassingly for everyone in government and the NHS, it could well be that all the figures in England in hospitals going back over a year or more may have to be recalculated.